Good morning. I've got another case for you I wanted to share. This is from yesterday. So I had a patient present on a referral from her family care physician. She'd been having repeated earaches and general pain, which she thought was TMJ. So we spent some time doing a little evaluation and diagnosis and took a 3D x-ray, and we came up with a diagnosis that she has a periapical abscess on the lower right and a significant recurrent periapical abscess on the lower left around a previously treated root canal. So most of her symptoms were on the right side. As you can see from these snapshots here, we have some widening of the periodontal ligament space and some nondescript kind of a bone destruction in there. And this is what really helped her get a feel for what was going on in her mouth. I had to explain to her that this is normal anatomy, this is the mental foramen, but this window in the bone there is an abscess that we can see manifest here, which is related to this tooth. Now, she had been having, like I said, earache. She was waking up in the morning with pain. Certainly, I think there's some clenching happening, potentially because of some of the discomfort she's been going through. But the earaches and kind of a ringing sensation, a tinnitus sensation in her ear on the right side had been bothering her for several weeks. So percussion testing, this tooth tested really, really tender. So it was very reactive to the percussion testing. And then we did a cold test on that tooth, and it was also extremely reactive to her. So my diagnosis was irreversible pulpitis, likely combined with necrotic pulp on that mesial buccal or mesial lingual areas, and recommended a root canal treatment. And we started her on antibiotics because she had to get home to see her kiddos, pick up her kiddos from the bus. But it's a solid, testament to me to how powerful this technology is. For us to be able to see what's happening in 3 dimensions, and to be able to diagnose for our patients these lesions that we couldn't necessarily see otherwise. And this one really, on the panoramic, was barely a hint of a dark spot, but with this 3D modality, we could see it loud and clear, what's going on there on the mesial buccal. Let me go back and pull up that tooth number 19. And this one, size-wise, this abscess is much bigger. So it's definitely something that we recommended urgent treatment for, to try to treat this one. Ideally I'd recommend trying to treat them concurrently. But if you look at the size of that hole in the bone, adjacent to that root space, it's really significant, a significant risk to her health. So for me, being able to see this and diagnose this and show it to the patient in front of the patient is just hands down one of the greatest things, in my opinion, that's happened in our practice, is being able to have this power and give it to our patients. So these images that I took, the ones that I showed you before, I printed these off and we gave them to her. Here's the abscess on the lower right. You can see that little arrows pointing to it. Here's the abscess on the lower left. And this angulation is a little misleading because of the way the CBCT, when you grab it and do a zoom into area, it'll appear like we're on the right side, but this is the lower left. And you can see how large that abscess is, especially on that distal root structure, and how big that bone destruction is there. And then, because she thought she had some TMJ, we went ahead and just used the 3D to do a TMJ study, where you set up the slicing through the condyles and the articular head there and look through it. I didn't see any adhesions. I'm not seeing any damage necessarily that I can diagnose. And after we did the cold test on that tooth number 30, she was like, yep, that's where the pain's coming from. So we kind of stopped looking at the TMJ. But these lines, as you see here in all the images, is basically because we were at the top of the sensor. So I think we could have positioned her a little bit lower, so we wouldn't have captured some of that streaming off of there, but still diagnostic, I think, from the standpoint of being able to see all this information. But yeah, I gave the patient all these to take home. Fantastic. She scheduled both the retreat with a new crown over here, new crown and core buildup, and then the initial root canal. So solid case, great opportunity. This was yesterday. Not sure why that date stamp. It's interesting. The date is yesterday. Well, we'll have to get them to update that. Okay, this is the 3rd of December. Got it. Weird. Wonder if they can reformat that. Anyway, thanks for watching. Please let me know if you have questions. Happy to give you more cases as they come along. I've got a whole bunch of them that I'd like to create videos for, and this is again, really eye-opening what we can see and how much healthier we can make our patients. So thanks for watching.